This is a key outlet. The government realized everybody, and all this was reinforced by a weekly television serial, which is now the most popular agricultural TV serial. I myself oversaw 260 unbroken weekly episodes, and it has crossed 380 episodes now. So all this integration of call center, three portals were there. The e-Krishi was one of them, funded by DIT through the UN program. The Kisan Kerala and Virtual University of Agriculture Trade recognized, done by Swaminathan. So it allowed that. So there is a model now. The model I will recommend is that ensure in every panchayat you create a I would like to call it a community enterprise. Let us try to reduce this size so that it is addressable because agriculture is highly localized and the knowledge should be local, not just for agriculture. Same thing can be done for the healthcare. For example, Janani Suraksha Yojana. Take a mother and child care portal for every panchayat. Run it with 10-20 knowledgeable people, build paramedical training program, reach out to every mother, the Anganwadi or the service workers, but they all now use mobile devices. They can take mobile portable kits, go to hard cardiac patients in their own homes and do a health assurance rather than a health insurance. This kind of convergence. Now, if you make 10 such enterprise in every panchayat using the various yojanas and planning programs of the government deployed in every panchayat. Each of them employ 20 people who are educated youth with IT skills in the respective domains. It may be culture and tourism, it may be healthcare, it may be e-governance itself in certain sectors and so on. Then you are employing 200 knowledgeable workers with IT skills right there, and there are 100,000 panchayats. We immediately talk of 2 crore employment in the rural areas. It's possible. The question is, we should now create these kind of platforms as such convergence platforms of organizations to come together to address an issue on the ground. Then we are talking of e-governance. Until then, we will be talking only e-government and not e-governance. These are the differences. Thanks.
Great, sir. I think excellent inputs. And now I will move to Dr. B.S. Bedi, pioneer in e-health. I will, and you have like seen the health IT, the pilots happening for over a decade now, and still the health IT is still a nascent industry. It's like not yet has like taken off in some sense. So how you see the challenges and the opportunities for health IT or e-health in India, sir?
Thank you, Ravi, and very good evening to ladies and gentlemen. See,
Yeah, yeah, it's
about a decade back, you see, I have been part of the so-called DOE for a long time, and over the years, when I started, the emphasis was on medical electronics. Slowly, when I superannuated in 2006, we were just talking about ICT, IT in health. See, interestingly, I remember the first experiments which we started by supporting technology development and then doing statewide some pilots and bringing e-health through telemedicine to, looking at our own geographical and population spread and disoriented proportion of, the physicians. It was interesting to see that, when we were talking about technology and providing, these systems and talking about the connectivity, etc., it used to look a kind of utopian situation, when the connectivity was so expensive, the hardware was so expensive. And suddenly, over this decade, the enormous change has taken place, which perhaps was our reason for looking at these technologies at that time. The things which started as experiment now see has become a possibility and a reality. And the interesting example of this is a effort which was started by two technology ministries, that is Department of IT and Department of Space, now has come to Ministry of Health. Incidentally, only yesterday and day before, I was in Sanjay Gandhi the postgraduate institute,
Just sir, I
attending a,
will interrupt. May I request the bar to close now, please? Just like let the panel get over. I'm sorry. Yeah, sir, please.
and what was the meeting? It was Ministry of Health and Family Welfare's conducted meeting on National Medical College Network. And why we are thinking about that? Why to empower, to look at this faculty crunch which is taking place at these medical colleges, and whenever capture the different knowledge and content which is being created at super specialty hospitals and make it and provide it to all medical colleges. So this particular how it is being made possible, because somebody has thought about a national knowledge network, that high quality, high bandwidth is being made available to all educational institutions, including the medical colleges. And rightly riding on that, we are now looking at that possibility. And then you see, it is now at one stage health ministry looking at connecting all medical colleges with super specialty hospital, and at three levels, a national hub at Sanjay Gandhi, then regional resource centers at major hospitals. And once that is done, we'll look at the next step, go down to district level hospitals from medical colleges, then to sub divisional, sub district level hospital. It is not only the health delivery, it is also empowering those people, doctor, nurses, etc., everybody using this particular modality. And it is already, and now a lot of parallel enabling uh, efforts are being done at the user ministry. Now we see a exercise which we did in DIT in 2002 2003, to suggest a framework for going in a very standardized way, right from information capture, patient records and all that. When the document came, it was a beautiful document. It lied on our website for 5 6 years, but there was no receptivity. You see, health ministry didn't understand that time what is the implication of that. I am very happy to say, after 5 6 years, a number of national initiatives started using that, whether it was National Knowledge Commission, whether it was Health Ministry through their task force, or insurance regulatory IRDA. So a lot of those things. And now with UID becoming possible, suddenly we find that EMR. And what is the next result? Health Ministry has set up a specialist group to suggest a standard EMR. So once you see, I am very confident that all these initiatives, and now it finally the baton being passed to the health ministry, e-health, and then another revolution which has taken place, which is this mobile. That connectivity divide already has been attempted in India. I think Honorable Chandrasekhar ji mentioned that. We are adding 18 million handsets every month. More than 750 million handsets are there. This will be another revolutionary element in the hands of the people, and the health delivery can go down right to persons. Only thing is that we have to work out the modalities. We have to work out the validity of the information which will finally reach, and how other delivery mechanisms can uh, really be you know guidelines can be and I can tell you, gentlemen, all those efforts are there from user ministry itself. So I am very confident that this revolution has finally taken place, or very near, in very near future it is going to be there.
Great, sir. I think that excellent inputs. And I will move on to Mr. Bhaskar. I think you were the only representative here from the industry. How you see the major challenges for both for rural, urban digital divide and e-governance uh, for India, and opportunities also.
Obviously, hello. So I have to admit that, as Mr. Secretary said, there's a phenomenal growth and improvement is happening in last decade and so, and we have a clear vision from the veterans and the governance as well as the leaders. There's a vision is there, projects are there, and we have a clear objective of getting what the common citizen should achieve from these particular projects. What my suggestion is always, or my perception is, do we have the right strategy, or if we have a right strategy and a clear process and policy to execute this, I think it is a fantastic place to be in. From my experience, I think I'm the odd person here from the technology vendor. I represent from the security industry. Things have changed a lot. The awareness after 26 bar 11, I'll give a classic example of 26 bar 11. People have realized that it is as a citizen, it should be my responsible to educate nearby, and we firmly believe that unless you wanted to achieve, if you wanted to achieve the success, you should have a technology or a product or any solution first should involve the people, educate the people, and put the process and policies in place, and then enforce it. Enforcement comes into picture, including our organization today has changed. Like, you wanted to achieve the objectives of the, whether it's a governance or whether it's the security, or even the technology, it has to involve the people, and enforcing with the right process and policies would obviously make this
Great.
successful.
Sir, I have a last question. Rural broadband is emerging as a big thrust area. How it is going to change the face of rural India as a whole, and rural governance also? How it will impact 5 years? How will the scenario be different? What is the vision of the government? What are you like thinking?
See,